Office hysteroscopy for conservative management of pyometra in elderly women. The aim of this video is to show the role and effectiveness of office hysteroscopy in the conservative management of benign pyometra. We present in this video the ambulatory management for diagnosis and treatment by an office hysteroscopy. Case report. An 81-year-old woman complained about postmenopausal vaginal discharge. On examination, a culture was performed without possibility of endometrial aspirative biopsy due to cervical stenosis. By ultrasound, the suspicion of hematometra or pyometra was confirmed. Look at the thin thickness of the myometral wall and the risk of rupture. We continue the complementary study to rule out possible underlying malignancies. The MRI confirmed the benign pyometra without suspicion of endometrial or cervical cancer. At that point, the microbiological cultures saw a Proteus mirabilis and Enterococcus fecalis, so a treatment with doxycycline was started. An hysteroscopy was performed to evacuate the endometrial cavity to avoid the uterine rupture secondary to pyometra with a cervical stenosis. All of them were performed by office hysteroscopy with a 5 mm Betocchi hysteroscope with automatic fluid irrigation. With the help of an hysteroscopic grasper of 5 French, we made the debridement of the uterine cavity to allow the discharge of the pyometra. Since the vaginoscopy, we could see how the fluid irrigation of the hysteroscope facilitates the purulent discharge to the cervical ostium. After the evacuation of the uterine cavity, multiple endometrial biopsies were performed with the diagnosis of chronic endometrial endometritis without malignancy. In this case, 2 hysteroscopies were performed to complete the evacuation of the pyometra from the endometrial cavity. The result was that the combination of office hysteroscopy and antibiotics allowed us an ambulatory diagnosis study and a complete resolution of the case reported.